My children are protected. My 6-year-old twin sons have been rendered immune to pneumococcal bacteria, varicella, diphtheria, tetanus, pertussis, polio, measles, mumps, rubella, and hepatitis B. Not only are my boys safe from catching these diseases, they have also reduced the risk of their kindergarten classmates catching them as well. All of this is thanks to Mississippi's strict law requiring immunizations for all children prior to entering into the school system. Having studied historical and trending data provided by the Centers of Disease Control and Prevention, the World Health Organization, and the Mississippi State Department of Health, I've learned of the irrefutable evidence proving the benefits of these vaccines and the evidence disproving myths of their harmful effects. Before the measles vaccine was widely distributed in 1963, an average of 500,000 cases were reported annually in the United States. You can see the average line before the vaccine was introduced. Since the 1970s, there has not been more than 70 cases a year. This dropped down significantly. Since 1955, diseases such as diphtheria, polio, rubella, and pertussis have been nearly eliminated in the United States. There have been some recent outbreaks in certain parts of the country, but thankfully those have not affected Mississippi, which can be contributed to the state's nation-leading percentage of vaccinations distributed to school-age children. To drive home the importance of early immunizations, I would like to discuss some of the overall effects of vaccinations, how Mississippi's rigid policy continues to prove the effectiveness of these vaccines, and some of the reasons why other states have problems keeping up with Mississippi's lead. Let's first begin by going over the positive effects of vaccines. Vaccines work from exposing a person to a very small or even a dead version of a disease, which forces the immune system to create its own antibodies. This develops the body's immunity without actually causing the person to catch the disease. Before vaccines were regularly utilized, even a small outbreak of a disease would quickly spread across the country and the world. The development and distribution of mass vaccinations has reduced or completely eliminated several of history's most virulent diseases. According to immunizeusa.org, vaccines prevent about 42,000 deaths per year. In an article on vaccines.gov, the term community immunity describes how vaccinated individuals in a community can protect others who have not been vaccinated due to medical restrictions. The more people that are immunized directly contributes to the reduction of diseases and eventually the eradication of most diseases. A strong example of this provided by the World Health Organization is that worldwide measles deaths have been reduced by 84% since the year 2000. By taking advantages of these overwhelming advances in preventive health, Mississippi now leads the nation in childhood immunizations. The Mississippi State Department of Health indicates that there are over 600 cases of measles nationwide in 2014 and 2015, but there have been 0 in Mississippi in 2 decades. As you can see, during the 6-month period of 2015, several states in the country had multiple cases of measles, but there still continues to be 0 in our state. Mississippi is one of only 2 states that does not allow for personal exemptions to vaccines, such as religious or philosophical beliefs. Because of these, immunization refusals are blocked by Mississippi. The state has 99.7% of kindergartners fully immunized for the 2015 school year, with only about 140 not receiving the vaccines. By comparison, Pennsylvania, which is a state that allows for parents to refuse the vaccines, had 22,000 unvaccinated kindergartners in the same school year. Statistic here that's from earlier this year, March of 2018, shows that in Mississippi, 99.4% of kindergartners received all of their vaccines at the beginning of the 2017-2018 school year. 99.4%. Mississippi Title 41, Chapter 88-3, the Mississippi Child Immunization Act of 1994, states that any child not in compliance at the end of 90 days from the start of the fall semester must be suspended until they are in compliance. This law was further expanded by Mississippi Senate Bill 2057, which took effect on 1 July 2018. All students must report to school with Mississippi State Form Number 121, Certificate of Immunization Compliance, at the start of the school year. This form contains all of the required vaccines for the age group, the doses and dates administered, currency status of the child's compliance for that school year. In a 2015 article by the Washington Post, Mississippi is described as a state whose laws lack the loopholes which allow for parents to choose if their child gets vaccinated. The article goes on to say, in the Magnolia State, public health trumps parental choice. So why are there so many unvaccinated children in other states? Over the years, more and more Americans believe that vaccines are no longer effective or that they actually do more harm than good. Dr. William Schaffner of the Vanderbilt University of Medicine states that even though there are roomfuls of evidence proving the safety of vaccines, people still choose to spread rumors and conspiracy theories. Dr. Schaffner goes on to state that young parents today have not seen these diseases, so they do not respect or fear them. I found some examples of personal quotes from former anti-vaccine advocates on voicesforvaccines.org. Some of these quotes are, preventable diseases have been eliminated, diseases had already started to decline before vaccines, or big pharmacy and the government are getting rich off of brainwashed, gullible people. Truth is, all of these arguments have been disproven, and they amount to nothing more than simple ignorance by people who think they're well informed. In 1990, the Vaccine Adverse Event Reporting System was established to act as a vaccine safety surveillance agency. This agency detects new and unusual or rare adverse events. They assess the safety of new vaccines, watch for an increase in known side effects, and they look for unexpected or unusual patterns. This agency reports that 85 to 90% of the data that is reported are only mild symptoms such as fever or irritation at the injection site. Before a vaccine can be licensed for distribution in the United States, it is reviewed first by the FDA, the CDC, the American Academy of Pediatrics, and the American Academy of Family Physicians. Then it's allowed to be distributed. Children are much safer from disease today than they've ever been, and nowhere else in America are they more safe than in Mississippi. Vaccines are the single most effective way of protecting children from disease. Mississippi has stayed true to its laws requiring immunization for school children, despite several other states leaving the choice up to their parents. The resulting strict laws have ensured that once eliminated diseases like measles continue to stay out of our state. Vaccines have gone through many developments and upgrades over the years, and their wide distribution has seen the extinction of several powerful diseases. Mississippi continues to uphold its hardline approach to vaccine enforcement, and the results of those efforts are proven every year. Despite many claims by non-experts and cousin's boss's wife's hairdresser, vaccines are truly safe. Today, there are several government agencies that exist only to ensure that high degree of confident and competent safety. Vaccines are proven safe and effective, and no other state in America cares for its future generations like Mississippi. If not for our state's insistence on mandatory immunizations, my own children and yours would not be as protected as they are now from fully preventable diseases, which is another reason why I'm proud to have my children grow up in the Magnolia State.